So I'd like to talk to you a little bit about a really common complaint in my practice that I hear from patients, but also a very common procedure that we do. And that has to do with your upper eyelids. Patients come in very frequently and they talk about how they look a little more tired, are having difficulty applying makeup perhaps to their upper eyelid, and they'd like to see some rejuvenation in that area. An upper eyelid lift can be done in the operating room, but it can also be done right in the office. From the start to the finish of the procedure, actually operating, it might take maybe 35 minutes, something in that range. We do check certain things in terms of their medical history. If you've had a history of dry eye, we have to warn you that it could perhaps exacerbate. It could make dry eye a little worse. We check for the presence not just of extra skin, but whether you have fat pads, nasal fat pad, or fullness as a result of your lacrimal gland. Or might you have a different situation called ptosis, that one eyelid or the other, or even in some rare cases both, is actually sitting on the surface of your eye a little bit lower, and that requires a ptosis repair, which is a totally separate and different operation. But if all those things check out, then you're typically a great candidate for an upper eyelid lift or upper eyelid blepharoplasty. Of course, there is some swelling and bruising. You're operating around the eyes. Very often, it's pretty modest. We can give you a medication called TXA if you don't have any contraindications. You can give that by mouth and a little bit before and for some days after the surgery, and it can reduce your bruising. If you get bruising anyway, we can use a little bit of intense pulse light and help you kind of chase away that bruising sooner. But by and large, after about 10 days to 2 weeks, most patients are looking pretty presentable. And then the benefit lasts for a long time. It lasts 10, 15 years. That can be enormously rewarding to patients. They look more vibrant, they look happier, they look more awake, and it's a big impact. For a procedure that can only, might only take 40 minutes and it can have that kind of result for that period of time, it's really very gratifying to patients. If you have more questions about this procedure, or if you think you might be interested in this, please get in contact with us and we'd be happy to help you with it.